Hi, Dr. Sivera. My name is Allison. I'm the founder, CEO of the Hereditary Neuropathy Foundation. I was so delighted to be at this conference. I'd love to hear about you and what you do. Are you a researcher, a clinician, both?
Hi, I'm Raffael Sivera, and I'm a clinical neurologist, so I'm actually one of the primary caregivers to the patients with CMT at my center. I work in Valencia, in a medium city of Spain, but we are the National Referral Center for CMT. And so we do see a lot of patients with CMT, and we try to take care of them in the most holistic way we can.
So the theme of this meeting has been very much focused on collaboration and bringing the patient voice into the not only standard of care and treating patients, but also research. So I'm curious, are you seeing patients as standard of care and research, or just standard of care?
Both. We do both standard of care and we do research, but it's true that sometimes differentiating both of them, sometimes is complicated, because when you try to do clinical diagnosis, you get to a certain point, and then from then on, maybe it's clinical research, but it's really also taking care of the patient. So trying to get a clinical diagnosis, trying to look for the functional mechanisms of CMT in that patient. So it's really, sometimes it's difficult to separate them. And I think that this type of conference allows you to see that the differences, not only from the clinical point of view, but also from the basic biology groups, that they have to work together to create synergies so that we can take better care of our patients.
So I'm curious, do you order genetic testing for most patients?
Yes, certainly. Yes, we order genetic testing. We receive patients normally who have not been able to get a genetic diagnosis for a second opinion. And those we see for standard of care, we certainly order genetic diagnosis to all of them.
And depending on the genetic diagnosis, is there research in specific subtypes, or is it more just all patients that come through your clinic?
No, we have specific certain lines of research. For example, in our group, was one of the ones who described GDAP1, which is actually quite frequent in Spain. It's more frequent than CMT2A in Spain. And so we do have a line of investigation there. We try to investigate also some of the rarer forms of the disease, because we have great collaboration with other centers in Spain. And so we try to establish the synergies and try to find more patients from rare forms of disease, so that we can try to look for different pathways or look for different phenotypic profiling of the patients. So it's
I'm so delighted to hear this, because the rare and ultra rare forms I think are really important, and that came up a lot during this meeting. So what do you think about this meeting and how it can impact the work that you're doing for GDAP1 and some of these other rare subtypes?
I think this type of meeting, the way in which we were all together, basic scientists, clinical scientists, stakeholders, patients, I think it's the way to move on. I think it's a great place for synergies to occur. And right now I'll go back to Spain and have 2 or 3 projects in my head, and I have 2 or 3 connections that I've done during the meeting that will maybe go on to be something, maybe not, but at least I have been able to do these types of connections for this type of meeting and this type of organization. So I would not only congratulate the organizer, but also encourage them to do it again.
I'm curious, so when you talk about these 3 projects, do you envision that you'll present them to the Federation for their thoughts on it, funding? Is it something that maybe you'd come back next year and present, that you initiated that at this meeting and you have results from that?
Basically, it's 2 ideas that we have to develop, and one that maybe will be presentable soon. But it
Are
is.
you able to say what the idea is?
Yeah, no, we're.
I hope to hear.
We're trying to get the GDAP1s, and to try to. There's certain hubs of GDAP1s not only in Spain, also in certain parts of Italy, I was talking with our Italian colleagues also about other hubs of GDAP1 patients, about the variability that there is in certain families and trying to find certain gene modifiers. And so that's it.
So this is music to my ears because HNF is very much dedicated. I always say GDAP1, so it's GDAP1 is the proper way to say it. So for me, what I'm just, from this conference, this idea of meeting you and your colleagues for this variant, I agree with you, the patients are all over the world, and we started this patient registry to start capturing data from these patients, not just in the US, but any of these countries, and translating the surveys and the information into different languages so we can serve you and your colleagues by giving you this data. So I'm just saying, I just know that we're here and we would very much like to help you do that with all the countries out there. And we'll talk about this over the next, all afternoon. But I think it would be a very good pilot to start with GDAP1. GDAP1, if we could start this as a pilot, maybe we can show success with a small cohort of CMT. And if it works well, we can move on to other subtypes.
It would certainly be great. I mean, and one of the main aspects also that was talked about in the conference is just this collaborative approach and the sharing of information that has to be our day-to-day. And sometimes it's difficult for certain hurdles that we have with protection, data protection, informed consent, but there's ways in which we can just join our data and try to move forward. So it would be great for us.
Excellent. Any other questions? Do we cover it? Okay.
Wonderful.
Great.
Okay.
Thank you.
Thank you very much.
Thank you.
Thank you.